Welcome, board members, staff, and members of the public to the meeting, and those that are going to be providing remarks this morning. I would like to ask everyone that has not muted if they would, because we are getting a lot of feedback. This is a public meeting. Meeting is being conducted virtually. The state board members are participating today, both by audio and video. The public can access the meeting through town hall streams and YouTube streaming. Both options can be accessed from the state board meetings webpage. The meeting agenda materials are also posted there. The archived video will be posted to the website following the meeting. Only board members, staff, and presenters will be able to speak. Board members are asked to hold questions, comments until the end of each presentation. Board members and staff should identify themselves when speaking. Dr. Solomon will respond to each question, comment, or call on the appropriate staff to do so. I will ask Dr. Simpson to take a roll call vote for any actions. Mr. Schoen will ratify any votes. I'd like to take this time to recognize our 4 new board members that have just joined us, and I'm so glad to have them with us, and they are extremely capable and qualified individuals, and I'd like to introduce them now. And first we have Mr. Sean Bartley, Esquire. Mr. Bartley, wave.
Thank you for welcoming me. I'm excited to be a part of the Maryland State Board of Education. I look forward to serving citizens of Maryland and especially students. Thank you.
Welcome. Dr. Susan Getty. Dr. Getty, I couldn't see if you waved. I don't have that video for you right now.
Good morning.
Next, we have Dr. Holly Wilcox.
Good morning, everyone. I'm happy to be a new board member.
Welcome. And of course, our new student member, Jason Wu. Mr. Wu.
Thank you, General Sumter. I'm excited to be here, and I'm excited for a great year.
Very good. Welcome to you all. We will now move into public comment. I will call on the people in the order of their registration to make comments. Comments are limited to 3 minutes per speaker. The time will be kept and monitored by Dr. Simpson. The time expires, the speaker will be notified and be permitted to finish their sentence, but is required to make no further remarks. At the end of the 3-minute period, speakers will immediately be released from the call meeting room by the meeting room manager. Comments shall be directed to the entire board, not to an individual board member or members. Board members will not respond to the speaker's comments, but will take all comments under advisement. Written statements and other materials should be submitted electronically to Dr. Simpson, who will see that copies are made available to the entire board. The first individual this morning is Ms. Cheryl Bose.
Sumter. I'm sorry, Ms. Bose. I just want to make sure that everyone can hear this timer.
I can hear it.
You can hear the signal. Okay. I just wanted to make sure of that. Thank you very much.
Do I start now?
No.
Yeah.
Yes, please.
Okay. Good morning, President Sumter, members of the board. This is Cheryl Bose, President for the Maryland State Education Association. As I wrote you a letter last week, we are extremely disappointed that educators, parents, and others were shut out of even the opportunity of serving on the task force for achieving academic equity and excellence for Black boys. I agree with Rachel McCusker's statements from your last meeting that we just need another report. We need real action. And to get real action, that takes buy-in and courageous conversations with the people working each day with our students, and those are our educators. Unfortunately, you're missing the voice of Michael Williams, a Black male educator in Montgomery County who runs the Minority Scholars Program. You're missing the voice of Dr. Richard Warren, former State Teacher of the Year, who is working with Salisbury University, working to attract and retain teachers of color. And you're missing the courageous voice of Kayla Moore, a new teacher in Prince George's County, strongly advocating for HBCU funding and expansion and a change to the current curriculum in our schools so that students have a broader understanding of Black history. All of these actions were laid out in not only a 2007 report by the Board of Education, but also the 2010 report, which was a task force on the education of Maryland's African American males. In fact, it went on to say that the 2010 report will be utilized as a foundation for an implementation plan to assist in addressing the elimination of the achievement gap among African American males in the state of Maryland. We write reports, we don't take action. And it takes implementation by principals, teachers, counselors, support staff, and more, all who have been refused the opportunity to serve on the task force to address the academic achievement of our Black boys. I also want to address the reopening plans that many of our districts are taking part in right now. It is at the top of the mind of educators, parents, and students. We did join with the Maryland PTA and BTU calling for all schools to start virtually. It's important that we get virtual learning right for all students before we can even try to begin a transition into in-person learning once all health and safety concerns are addressed. This will take conversations, this will take funding, and this will take an eye to what's happening with COVID cases. We can see by Major League Baseball in schools in the southern states, this is a monumental task, and we need to learn from their mistakes or not rush into this quickly. We will be sending a letter to you, the State Board, and Dr. Salmon, requesting various regulatory waivers that are needed as we begin this school year during the pandemic. The most urgent is to address the administration of the KRA, the Kindergarten Readiness Assessment, and how that can be accomplished completely virtual for many of the schools. So I thank you for the opportunity to speak.
Thank you. Thank you very much. Next on the comments will be Lisa Van Buskirk.
Good morning, Brigadier General Sumter and members of the Board of Education. I am Lisa Van Buskirk of Start School Later, Maryland and Anne Arundel County chapters. There are also chapters in Baltimore, Howard, and Montgomery counties. The goal of my All Those volunteer organization is to educate communities about the physical and mental health, safety, and academic benefits of age-appropriate school hours. Decades of research on the biologically driven changes in adolescent sleep patterns culminated in the recommendations of the American Academy of Pediatrics in 2014 that has been subsequently echoed by the American Medical Association, U.S. Centers for Disease Control, National Parent-Teachers Association, and nearly every other public health organization in the country that no middle or high school should start before 8:30 a.m. Also in 2014, a joint report by MSDE and the Maryland Department of Health encouraged school systems to evaluate starting school after 8 a.m. Pre-pandemic, Maryland's public schools and high schools started between 7 and 9:30. The average high school start time was 7:54, and the average middle school start time was 8:11. Many Maryland students have hour-long bus commutes, which means they are rising in the 5 o'clock hour to catch buses in the 6 o'clock hour for schools that start in the 7 o'clock hour. When combined with a biological drive that prevents them from falling asleep much before 11 p.m., the hours of potential sleep are limited. In 2018, the Youth Risk Behavior Survey asked middle and high school students how many hours of sleep they were getting on a school night. Only 21% of high school students and 55.3% of middle school students self-reported 8 hours of sleep. They need closer to 8.5 to 10. Those numbers are lower than in 2014, the last time the question was asked. But more importantly, the amount of sleep self-reported by minority students was even lower, especially at the high school level. The vast majority of our adolescent students are chronically sleep deprived. Age-appropriate school start times is a proven intervention to improve potential for more sleep and, more importantly, provide academic safety and health benefits. My concerns today are regarding the Maryland Together recommendations and the Task Force for Achieving Equity for Black Boys relative to school start times. In July 2017, MSDE released its report, Innovative School Schedule, Recommendations to Enhance Student Achievement. Right now, Maryland school systems are creating innovative school schedules to recover from pandemic closures, yet the report on that very topic is not referenced in the Maryland Together plan. Specifically, the report discourages school systems from lengthening the school day, which is contrary to the Maryland Together plan's suggestion to start school earlier or end school later. As Dr. Green mentioned in the meeting of the Task Force for Achieving Equity for Black Boys earlier this month, reports aren't meant to just sit on shelves, but should be actively in use. I encourage the board to review the Innovative School Schedules report relative to the Maryland Together plan to address the discrepancies between the two. In regards to the task force itself, I encourage this board and the task force members to evaluate the roles of early start times on minority student achievement. The role of school start times applies to both study group 1, the social emotional behavioral support group, because mental health is negatively impacted by sleep deprivation, and study group 3, curriculum instruction, because students asleep at their desks cannot learn, no matter how interesting the curriculum. I would like to provide additional research that disadvantaged students benefit the most from age-appropriate school hours, similar to what I provide to Anne Arundel County's joint initiative to eliminate the opportunity gap. I hope a member of the task force will contact me in the future so I can provide the research. Thank you.
Thank you very much for those comments. Next, we have Alextra Hayward. Hayward?
General Sumter, this is Charlene. Ms. Hayward did not sign on. She is not in the meeting room. And I left the meeting room as instructed to the registrants at 9:35.
Thank you very much. We will move on to Sealy is next on the list.
Hello, can you hear me?
Yes, we can.
Good morning. I wrote my concern on behalf of all the parents in Maryland. As you know, we've all been impacted by the pandemic and have had to recalibrate many aspects of our lives, including education of our children. I'm sorry, I just ran. Over the last few months, parents have partnered with their school districts to ensure the continuity of our children's education. With that said, parents are under undue burden of balancing homeschooling along with working from home. We have borne a significant portion of the responsibility. So I am here today to ask the following on behalf of all parents. Can the MSDE provide a full day of virtual learning to all students with active participation of teachers? I ask that teachers keep the same schedule, including being in front of their students in the virtual setting with appropriate breaks, lunch hour, recess, PE, as is done in other states. I ask that the same schedule that the teachers use in the classroom be administered to the children on a virtual platform. They should not reduce the content, neither the valued time the students need with the teachers and their classmates. I ask that the school district explore the full capabilities of the Zoom or any other platform that they deem appropriate to engage the students. This will encourage social interaction and provide opportunities to ask questions and interact with their teachers. I ask that the school follow the pre-pandemic schedule of administrative and teacher workday and not deny the school-age children in Maryland their allotted time of learning, whereby prior to the pandemic, it was deemed the appropriate time for learning. While teachers are trained to deliver instructions to a child, the parents are not. And so, over time, we're going to see a decline in what the children are absorbing and what they learn. This in itself is widening the achievement gap, and also it is in direct contrast to what the MSDE stands for, whereby they state we should have no child left behind. We are going to be having a lot of children being left behind because the parents are not able to deliver the content because we're not trained teachers. As you might have heard, all over the world, teachers are taking jobs online because they have valid time and while they're receiving pay from the district. I believe they should be honoring their contract to provide a full day's work or a full day's pay. If they are able to take on extra jobs, then they certainly have time to be in front of the scholars in a face-to-face environment. I propose that we take a hard look at our current online learning platforms and teaching methods to promote more interaction between the teacher and the student. We can look at the models of other states.
Thank you very much. The time has elapsed.
Thank you. Thank you so much.
Thank you.
All right. Thank you.
Next, we have Shanae Robinson.
Here.
Morning.
Good morning. I'm so sorry. I was actually just listening to everyone. My deepest apologies. I actually didn't write anything down. This is kind of just commentary on when the schools reopen, if they do at this point. I have a 16-year-old sister who is in high school or was in high school, and we are very close, and long story short, when she talks to me about school and also this pandemic, long story short is these kids do not care. They don't care about doing well in school because parents don't care, and they have told me themselves that teachers don't care at all. They are just psychologically warped. They don't care about doing well in school. They don't care about their futures. They don't care about anything. And including my sister is starting to go down that path. And when schools reopen, I don't know when they will or if they will at this point. I would like to see with the school counseling some type of, if it's possible, if there's any type of funding that's possible for this position to be open, some type of psychologist or therapist, something to be intertwined with the school. Because I'm actually friends with her friends at this point, and I care about seeing the people that come after me succeed. And whenever I hear these children say that they don't care about school, it breaks my heart. They don't care about how well they do and this pandemic, of course, nobody's in control of this. They really don't care. And virtually, they're not paying attention. My sister tells me all the time. And, I don't know if it's just the teachers that are just not able or, virtually the technology is just not up to date. I'm not too entirely sure, but I feel like we need to start putting people in place that actually care about the students. I am really heartbroken that there are people the source is pretty much coming to me or just telling me as if I'm very close to them, saying that, well, the teachers don't care, so I don't care. Or their parents and the teachers don't care, so why should I? They say that to me all the time, just free will. They say it all the time. And I really, really think that the Board of Ed needs to talk to all of the teachers very seriously, sit them down or do something virtually for them to understand that these children are drifting away. And yeah, like I said, pretty much when schools do open, if they do reopen, some type of mental health awareness needs to be, like, the bar needs to be taken up a notch. I don't know if there needs to be some type of therapist or some type of psychologist inside the school, but yes, that's all I have to say. Thank you.
Thank you. Next, we have Ms. Caudry. Hope I'm saying that correctly, Ms. Chaudhry.
Yes, this is Mr. Chaudhry, and good morning, and thank you for allowing me to submit testimony before you today. My name is Anil Chaudhry, and I am a parent of 3 children in elementary, middle, and high schools in the Montgomery County Public School System. I would first like to take a moment to recognize all the educators, bus drivers, food service staff, and other support personnel for their heroic efforts last spring to ensure some sort of continuity of services. Today, I would like to comment on the framework to prepare and execute risk-informed plans that provide a transition path to normal school operations. I am here to support the use of consensus-based risk mitigation strategies to address the following 3 issues impacting students in Maryland. First and foremost, our most vulnerable students will have lost 6 months of full-time in-class learning per day, which equates to approximately a year of lost learning and learning regression. We cannot afford to fall back further using unproven online education models, especially when online learning is ineffective in households that have limited access to technology or secondary learning resources. Second, and most importantly, online education prevents the timely recognition and resolution of cases where children are being physically, mentally, psychologically, or emotionally abused at home by parents or caregivers and suffering chronic neglect at home. Third, parents and caregivers who work for small businesses, the engine of America, need to go back to work now to earn a living with dignity and allow their families to maintain their current standards of living. In-person education is a key to ensuring that we don't economically harm Black and Brown families in Maryland. Therefore, for the reasons mentioned above, it is essential that public schools in Maryland open now for in-person education using appropriate, adequate, and reasonable risk mitigation strategies that allow all students who need in-person education to receive in-person education. Vouchers can be a part of that temporary strategy to ensure that we are leveraging the private sector to supplement public sector resources. In order to resume in-person education, we must take these risk mitigation steps endorsed by CDC, OSHA, and AAP. First of all, build a robust and innovative plan to permit every parent and caregiver that needs in-person education to receive in-person education. Adopt a risk management framework that prioritizes in-person delivery of education over online delivery of education, starting with 20% utilization of buildings now. Adopt standards endorsed by CDC, OSHA, and AAP, which allow for a 3-foot separation among students wearing masks to increase classroom capacity and school bus capacity in a safe manner. And taking these immediate common sense steps that comport with scientific consensus will allow Maryland schools to offer in-person education to every student that needs a structured school environment while supporting families that prefer online education. Thank you very much for allowing me to comment.
Thank you. Next, we have Courtney Tass.
Hi, can you hear me? Hello?
Yes, we can.
Okay, great. Thank you for the opportunity to share comments with the State Board to express Teach for America's concerns regarding the state's application of the new Basic Skills Assessment Policy for licensing teachers in Maryland. My name is Courtney Cass, and I'm the Executive Director of Teach for America Baltimore. We've partnered with Baltimore City Public Schools for nearly 30 years and with Prince George's County Public Schools for 13 to provide capable, diverse teaching talent. In Baltimore, we have 500 teachers and more than 50 school and district leaders, and more than half of our new TFA Baltimore teachers identify as people of color, with more than 40% coming from low-income backgrounds. In Prince George's County, we have over 70 alumni teachers, and close to 60% of our teachers identify as people of color. I'm here today to express concern about the state's inconsistent application of the new Basic Skills Assessment Policy. The new board policy allows new teachers in Maryland to demonstrate mastery of basic skills if they earn at least a 3.0 GPA on their most recent degree. We and other alternative preparation programs initially understood that this policy would apply to all new teachers, including those in our program who enter on a resident teacher certificate. As you may recall, Tavon Lawrence, the site director for the Baltimore City Teacher Residency, another alternative preparation program in Baltimore, provided public comment in support of this policy at the April 2019 meeting. This past September, we learned that MSTE's interpretation of this policy sets an inconsistent standard for new teachers across the state. Teachers from traditional programs and those entering on a conditional certificate are able to use the 3.0 GPA measure, while teachers in alternative programs must all present scores from a basic skills exam. What's most concerning is how this policy disproportionately affects new teachers of color. Maryland's alternative preparation program, those whose teachers are excluded from the 3.0 benchmark, serve teachers of color at the highest rate. Based on Maryland's 2017-18 school year Title II data, 53% of enrollees in alternative programs identify as people of color, compared to 33% of enrollees in traditional programs. MSTE's interpretation applies additional barriers to teaching for programs that provide a critical pipeline of new teachers of color, including additional cost of testing, time to prepare for exams, and the effort to pass the exams. We respectfully seek an immediate remedy, as it has an immediate effect on new teachers. It is important to note that while we are coming to the State Board now, we have previously operated in good faith by working with MSTE staff to identify remedies and state regulations. Because of delays in the regulatory process, no resolution has been adopted. We see several possible ways to address this issue, and I'd refer you to TFA's written comment for full citation of the regulations at issue. Baltimore City Public Schools and the New Teacher Project have also shared written comments for today's meeting on this issue. We look forward to working together to meet the demand for highly capable teachers for all of Maryland. Thank you for your time.
Thank you. Next, we have Adley Fabricant.
Oh, Adele. She and I were on the same issue, so she's not here. She signed on to the same letter.
All right. Thank you very much. Next, we have Lacey Collins.
President Sumter, Ms. Collins did not sign on to the meeting room as instructed to do so to provide public comment.
Thank you. Mr. Thomas Warner. Morning.
Good morning, General Sumter and other members of the Maryland State Board of Education. Thank you very much for this opportunity to offer comments. Yes, my name is Tom Werner, and I have resided in Frederick County, Maryland for the past 45 years. And over the past 7 years, I have volunteered and worked on the issue of substance abuse, focusing primarily on prevention and education. That is the subject of my comment this morning, directed to the entire board. I am here in support of efforts to ensure effective compliance with the December 2019 Maryland State Department of Education regulation that requires substance abuse prevention instruction in our schools this year. Alarmingly, since the beginning of COVID-19, there has been an additional increase at the national, state, and local levels of substance abuse overdose deaths over and above the historical rates of increase. The vast majority of overdose deaths do occur at ages greater than adolescence. However, all of these individuals started with some form of substance abuse in their adolescent years, namely alcohol, marijuana, and others. The latest 2018 CDC Youth Behavior Risk Survey indicates that adolescent substance abuse is a continuing problem in Maryland. Traditional substance abuse oversight and prevention by our school staff and parents under school reopening scenarios will be much more difficult. Therefore, it is additional motivation for effective compliance with the December 2019 Maryland Department of Education regulation requiring substance abuse prevention instruction. It will be vital to the continuing health and well-being of our children. I appreciate your time this morning and especially your hard work in these challenging times. Thank you very much.
Thank you, sir. Next on the agenda, pursuant to Section 3-305A of the General Provisions Article of the Annotated Code of Maryland, the State Board will adjourn into executive session to discuss the following. One, internal board management item. I believe in, for myself personally, into a process of an immediate as president to provide a smooth transition. Therefore, I'm going into my last year. I will not be running for board president. I would like to ask if there is a motion to go into executive session.
This is Rachel.
This is Chip DeShiel, and I move we go into an executive session.
I believe we had Ms. McCuster as a motion. Mr. DeShiel, are you a second?
Yes, I am.
Motion made and seconded. All those in favor signify by waving and saying aye.
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 Opposed? Abstentions? Mr. Schoen?
The motion passed unanimously.
Thank you. We will reconvene at approximately 10:30. Thank you very much.